Hello, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome to our project. We are group 3. We are going to present to you our project, which is COVID-19 health card. I am Muhammad Abdul Rauf Saleh Lazim. I'm going to take you through the background of our project. So we have done some interviews because we need information as much as we can take. So our background questions focus on 4 main points. The first point, that we want to know how many times a week people leave their homes and their apartments to go to the public places like markets and etc. We also want to know about their information about COVID itself, about how they know they are infected or the other people infected. We also want to know the activities during this pandemic and during this lockdown hours. They have been locked down for weeks. And the last information we want to know is how many times they get infected since the beginning of this pandemic in 2019. And after doing several interviews, we can summarize the background in 4 points, main points, 1 point for each question. So the answer of the first question, we found that we can summarize it by that the people leave their homes about 6 times a week. And the answer of the second question, we found out the people usually know that a person is infected by seeing his condition and his symptoms. And the answer of the third question, we found out that people usually spend their time playing video games and working online, of course. And the answer for the fourth question, we found out that people get infected about once or twice since the beginning of this pandemic.
Deciding game. First, in the problem statement, there are some pain points during this pandemic COVID-19. First, gathering people has high risk of getting COVID-19. Their small space is easily increased risk of viral transmission. Then, life is not safe and not freedom, which is developing dangerous symptoms by COVID-19 and need to always stay at home. The fourth is movement control order, that is NCO, waste a lot of time that they cannot do the outside important activity. The number 5 is people worry from taking infection to their family members because they hope they are all the family always healthy.
I am going to talk about the needs of the respondent in this project. This part consists of 2 questions, which the first question is, in your opinion, what is the most important aspect when it comes to the prevention of COVID-19? And the second question is, based on your opinion, suggest a technology that helps us in preventing the spread of COVID-19. The main response of the respondents are, they want to have a proper way to get vaccinated. For example, taking several doses of vaccine. The second one is to have a better system to control the standard operating procedure. Other than that, they suggest to have an AI that can track and trace the epidemics to predict the appearance of the virus and give effective response. The fourth one is to replace MySejahtera app with a physical item. And lastly, they want to have their own record of COVID-19 status. Since our health card contains a smart chip, we can save our information and filter the infected people. Therefore, the objective of our project is to help country in controlling the COVID-19 outbreak, and the second one is to help the users to keep in track with their health condition during the COVID-19 pandemic. Other than that, the health card can also support people in receiving treatment if they get infected by COVID-19 and to have people to schedule their vaccination. Last but not least, by having this health card, we can solve the problem that not everyone owns an electronic device.
Next is the scope of the project. The target group of this project is for everyone in the community. Project timeline. We also include the list of material and the best cost estimation
the main
in the building
component, a
of our
smart
project.
chip, and the list
For the
of
conclusion,
confessions by
our
the
main purpose of this
The
project
back
is
of
to
our
overcome
card
the problems
consists of the
faced in pandemic
signature to
COVID-19,
symbolize
which
the
has not
agreement
approved
of
treatment.
this card.
It's very important to prevent the spread in the society. The main points in preventing the spread in society are hand sanitizer, social distancing, and quarantine. Hence, we create a COVID-19 health card for each pupil by using it to prevent touching with each other, which increasing scanning data personal capacity. Detecting more positive patients in the community will also enable the reduction of secondary cases with stricter quarantine rules. Hence, our goal by using this product is to achieve a safe and peaceful society without infection COVID-19. That's all for us. Thank you.